How are we doing today? Real quick one for us. So I had the opportunity, and a number of you did as well, to go to see Dr. Brad Golowki last Tuesday here in Perth. It was an absolutely fantastic evening for anyone who was just getting their first dose of Brad. Welcome. He is a absolute firecracker, does amazing work, and someone who has definitely been a massive influence to myself. I actually have photos that popped up from 2015, me and him having a beer in California. So it was really cool to see him again. But I wanted to run through a really quick technique that he brought up that evening, and something that I took from him a while ago after hearing it on one of his podcasts. And it's a very quick and simple process for when a patient has a muscle spasm, but it's not a true muscle issue. So obviously, as chiropractors, you have the choice to do as much muscle work or as little muscle work as you'd like, right? Your treatment methodology and what you handle and don't handle, as we've discussed in the U module, is all up to you. And this is a really nice one for when someone doesn't have a true muscle issue. So there's not a tear or anything like that going on. There's a bit of spasm going on, and how to make sure that you're not then having to do unnecessary treatment or things that are out of your scope. So the classic example who Brad uses is the rhomboid. When people get sort of ribby or spinal sort of soreness, and they're like, yeah, I've got a spasm right here, right in the middle of my upper back through here. And the first step is always to agree. So the first step is put your hand on it and go, all right, yeah, I feel that. Yeah, that is in spasm. You're right. Step two, though, is to go, all right, let's see why that's going on. Because we know local muscle spasm is often a reaction of dysfunction at a spinal segment. It's the way the dorsal innervation reacts to the muscles around it. Once you start to get some chronicity in that area, that's where you start to get the recruitment of the major muscles and the postural supports as well. So you can go, all right, let's see where that's coming from. You then follow it back to the spine or the rib head, depending on where you're adjusting or what you're finding. And then you sort of have that there it is. That's what's causing that. Step three, obvious one, adjust it. Clear it, get that moving great, that's moving better now. That should really help. And then, as Brad said, the pro tip, you let them know, hey, next time I see you, let me know if that's still going on. So that way you haven't had to do an extra amount of stretching, an extra amount of Graston or TRT or any of these things that is really not necessary, because you just have to give the body a chance to correct the issue and then to allow it to relax. And that way you've saved a bunch of your time, you've created efficiency, and you haven't withheld any kind of care or anything like that. It was just an unnecessary case. So that's where that's really important and a true muscle issue. If it's not, this is a really good educational response to show to patients, hey, this is actually coming from here. Let me correct that. Let me know if it's not gone. And I guarantee you, and this is already what I've found in practice, so few people ever come back and go, oh, it's still there for a little bit. Almost every case, the person never brings it up again. Really, it's only if I go, hey, just wanted to double check, how did that go? So you can have that communication moment of being like, yeah, that's pretty cool. Hey, we just did that. We got this result. So there's the little step. Agree. Let's see where that's coming from. Adjust it. Let me know if it doesn't go. Put it into practice. Let us know how you go.